I've been getting so many questions on metabolic syndrome, so I thought today's podcast we would go over what is metabolic syndrome, what are we looking for, what signs, and do we have it? So I want to talk about what metabolic syndrome is. It's the number one silent killer in America today. And what most people don't realize is that it lays the foundation for chronic inflammation, insulin resistance, and cancer. If you've been told that your labs are fine, but you're exhausted, inflamed, overweight, and foggy, this message is for you today. So what is metabolic syndrome? Metabolic syndrome isn't one condition. It's a cluster of risk factors that dramatically increase your chances of heart disease, diabetes, stroke, and cancer. I see this same pattern every single day with my cancer patients. Here's what we look for: elevated fasting blood sugar, high triglycerides, low HDL, which is your good cholesterol that we need. You got to remember, statins always taint that HDL, so if you're on a statin, this is something to be mindful of. High blood pressure is another sign. Abdominal obesity. If you have any three of these, you definitely have metabolic syndrome. But it doesn't stop there. Metabolic dysfunction is the beginning of something much bigger. It's how your body signals distress, and it's one of the most underlying factors in cancer development. Inflamed cells definitely mutate. Insulin resistance feeds tumor growth. Poor detox pathways and visceral fat create a breeding ground for disease, which means cancer is going to grow. What the standard system misses. This is the problem. Most traditional labs miss early metabolic breakdown. You're told that your labs are normal. The nurse calls you on the phone and says everything looks fine and we'll see you again in 6 months or a year. But normal isn't optimal. A lot of things can change. Here are the labs that I run on every patient concerned with inflammation, cancer risk, or just not feeling their best. We run the fasting insulin, your HOMA-IR, which is your insulin resistance marker, high sensitivity, CRP, and inflammation, hemoglobin A1C, fasting glucose, also your lipid panel with particle size. I always make sure to include the LPA in this. If you're a patient of mine, we are running the LPA to see if you're at a stroke or heart attack risk. Homocysteine is another marker. Ferritin, GGT, which is a liver inflammation marker. Vitamin D, your DHEA, reverse T3, free T3, free T4, your CBC, and CMP. Also, if you're coming to me as a cancer patient, I always look at the LDH as well, because this is tissue damage and it's a really prevalent cancer marker. And for patients with a family history or symptoms, I also run the galectin-3 and Nagalase as well. Circulating tumor cells, which is your CTC count, is another test that we can run. Also, I am a practitioner with RGCC, and this is also a great test to test chemo substances or natural substances to see what you're sensitive to. So you're probably wondering, what can you do right now? So let's talk about these actions. Reversing metabolic syndrome is not about crash diets or gimmicks. It's about shifting your internal environment. And if you've heard me say, I'm always talking about the terrain. So we have to make sure that the environment in your terrain is healthy. So here's the foundation. We have to balance the blood sugar. Cancer cells love glucose, and so does inflammation. So this is where we're going to start, and you can start this today. No more than 20 to 25 grams of added sugar per day. 30 plus grams of fiber daily. And here's one that I always preach. Never eat naked carbs. Pair them with protein or fat. You also want to fast about a 12 to 14 hour window. That means no later than 7 p.m. to 7 a.m., a good fasted window. Gut reset. 2. Targeted supplementation. These are some of my go-tos based on labs and clinical outcomes. Berberine. It lowers blood sugar and it supports insulin sensitivity. Also shrinks cancer cells, helps to regulate cholesterol. It's one of my go-tos. Love berberine. Magnesium glycinate or citrate supports over 300 metabolic pathways. Your omega-3s, EPA, DHA, anti-inflammatory powerhouse. Vitamin D3 and K2. It's for immune modulation and hormone balance. Sulforaphane. We love sulforaphane, especially peak revival sulforaphane. It definitely is potent. It promotes detox, kills rogue cells, and it supports glutathione. Curcumin. It reduces your TNF alpha, CRP, and it supports abnormal cells. So it gets rid of that cell death. Probiotic and L-glutamine for gut lining and microbiome health. DIM. Highly recommend DIM, especially if you're estrogen dominant or if you're at a cancer risk for a hormone-driven cancer. DIM is a great supplement to add into your ritual. And some optimal or optional supports would be metformin or something natural like just adding in bitter melon or cinnamon extract. Ceylon cinnamon is something that I talked about yesterday, I guess, and I love adding it into my ritual. BPC 157, haven't talked a lot about it, but I actually take it myself. It's a healing peptide that aids in gut repair and inflammation control. I'm in love with what effects it's had on my body, for sure. The cancer connection, I want to talk about this. The part that no one's talking about is the relationship between metabolic syndrome and cancer. These two guys are deeply connected. Cancer is a metabolic disease at its core, driven by mitochondrial dysfunction, insulin surges, and oxidative stress. Tumors hijack your glucose and insulin pathways to grow and avoid death. Chronic inflammation, which I always say chronic inflammation is the root of all evil, it absolutely is. From visceral fat, poor sleep, and processed foods, they lead to cytokine storms in the body that keeps your immune system busy, which means it's distracting from cancer detection. Patients with insulin resistance have higher rates of breast, colon, pancreatic, and prostate cancers. Poor response to therapy. Increased reoccurrence and mortality. But, this is the kicker, when we restore metabolic balance, we tip that scale back towards healing. We make it harder for cancer to survive. That's what we have to do, is we have to make it impossible for cancer to survive in your body. We have to get the terrain healthy. So here's your action plan. Let's simplify these next steps. Run the right labs. Don't wait for symptoms. If you want help with this, reach out to me. I do this every single day. I'm always studying blood work panels. Eat for cellular healing. Whole foods, anti-inflammatory herbs, targeted fasting, low glycemic load. Move your body. Daily walking, strength training at least 3 times a week, and a sauna or cold exposure if you can. I love both of them. I think they both have their benefits, especially with cancer prevention and maintenance. Take smart supplements. Don't guess, test, and target. Just because you heard someone say it was great for you at the gym does not mean that your body needs it. Track progress. I recommend quarterly labs when starting a new protocol. You don't have to wait for a diagnosis to start healing. Metabolic syndrome is reversible, and with it, you take control over cancer risk, fatigue, weight gain, and even aging. This is about creating an environment where disease cannot thrive. This is about building a body that's anti-cancer, anti-inflammatory, and fully alive. I'm Dr. Cindy Ross, and I believe cancer is not a death sentence. It's a call to restore your terrain, rewire your choices, and reclaim your power. I always say getting sick with something like rheumatoid arthritis or cancer, it makes us a better person. It makes us more of an advocate for our health. So think of it as the silver lining that you are in control and you get to rewrite your story. Let's shift from survival mode to revival mode.